Illinois' public health department says that black women in the state are 3 times as likely to suffer from a pregnancy-related medical condition than white women. Capitol Bureau Chief Max Cotton explains how the governor and the lieutenant governor worked with lawmakers to improve birth equity.
All women deserve access to affordable and accessible health care. And so the Birth Equity Initiative does that.
That's why Lieutenant Governor Juliana Stratton spearheaded legislation to improve outcomes across the state.
Black women are 3 times more likely to die from pregnancy-related complications. But it's not just about black women. We think about women in rural communities.
The bill would require private insurance companies to cover all pregnancy, postpartum, and newborn care provided by perinatal doulas or licensed certified professional midwives. This includes home births, home visits, and support during labor. Insurers would also be required to cover home visits by board-certified lactation consultants, including the cost of recommended breast pumps, breastfeeding supplies, and feeding aids.
This is not a partisan issue. This is a health issue, and it impacts every woman across the state of Illinois.
The bill passed along party lines, with all Republicans opposing it. In their opposition, they cited the bill's mandate that insurers cover abortions without a copay.
If you have an abortion, no copay. If you have a baby, you have to pay a copay. If you have a miscarriage, if you suffer a miscarriage, you still have to have a copay. Now, does any of that make sense?
CDC data shows more than 80% of pregnancy-related deaths in the U.S. are preventable. The bill's supporters argue the legislation will save lives.
We're talking about saving lives. We're talking for all women. And we're talking about women, all women, being able to go home from the hospital alive and well with their babies.
In Springfield, Max Cotton, WGEM News.